Welcome to today's Explainer. We're jumping right in to put a spotlight on a wildly misunderstood and, frankly, completely misdiagnosed chronic condition that is affecting millions of people. Today, we are cracking the code on the science and the reality of lipedema. We'll be using some highly specialized expert insights that come directly from the Joel Wellness Clinic. They're a leading center when it comes to diagnosing and treating this hidden epidemic. So listen, if you have ever felt totally dismissed by the medical system when you bring up unexplained physical changes, this Explainer is going to give you some profound, long overdue clarity.
So, let me ask you this. Are you struggling with incredibly stubborn fat? It's a reality that brings just immense frustration to so many of us. You do everything right. You maintain a calorie deficit, you exercise religiously, but there is this stubborn and often very painful fat on your lower body that literally refuses to budge. For years, we've been taught that all fat is just stored energy waiting to be burned off on a treadmill. But what if it isn't? What if what you're experiencing isn't regular weight gain at all?
Well, the reality is, it might actually be lipedema. And the numbers here are absolutely staggering. It affects an estimated 11% of women in the United States. Let's put that into perspective for a second. That's nearly 17 million people who are battling a condition they might not even know they have. It's a massive, completely hidden epidemic. We're talking about patients frequently going years, sometimes decades, without proper recognition or treatment, simply because it gets misdiagnosed as standard obesity time and time again.
Section 1. The hidden fat disorder.
Okay, so what exactly is it? Lipedema is not just quote-unquote extra fat. It's actually a chronic fat tissue disorder. It causes this abnormal buildup of fibrotic, nodular fat, so think hard, knotty tissue under the skin, and this usually targets the hips, thighs, buttocks, and arms. But here's the crazy part. It's symmetrical, meaning it happens on both sides of the body equally, but it notably completely spares the hands and the feet. It basically stops right at the ankles or the wrists, creating a very distinct, disproportionate physical shape. So hear me when I say this. It is not a lack of willpower. It is a real, clinical, physiological disorder. And beyond just having a disproportionate lower body, the day-to-day reality is tough. Patients frequently experience physical pain, severe tenderness, or this heavy, dragging sensation in their limbs. You might notice you bruise super easily, or you can actually feel those hard nodules right under the skin. And a massive, massive clue here is the timeline. Lipedema is heavily tied to our endocrine system. This means it almost always first shows up or gets significantly worse during major hormonal shifts in life. We're talking puberty, pregnancy, or menopause.
Section 2. Lipedema versus lymphedema. Now, while they definitely sound similar, lipedema and lymphedema are fundamentally different beasts. As we just learned, lipedema is a symmetrical fat buildup that spares the hands and feet, and it's often painful and triggered by hormones. Lymphedema, on the flip side, is a fluid buildup. It's caused by a problem in your lymphatic system. It is usually asymmetrical, so it might just affect one arm or one leg, and it typically does swell the hands and feet. Plus, it usually shows up after a cancer treatment, surgery, or some kind of physical trauma. Getting the exact right diagnosis here is absolutely paramount because the treatment pathways for these two things, they're completely different. Section 3. Dr. Joel's specialized approach. This brings us to the medical detective who is actually solving this problem, Dr. Binju Joel. She's the medical director of the Joel Wellness Clinic, and she is dual board certified in both internal medicine and obesity medicine. What makes this an absolute game changer for a lipedema patient is that her extensive fellowship training uniquely qualifies her to look at a patient and clinically distinguish between regular obesity-related fat deposition and lipedema fat. This means her patients aren't just getting the same tired advice to eat less and move more. They're actually receiving an accurate diagnosis and a hyper-individualized treatment plan. And Dr. Joel's dedication goes way beyond the four walls of her clinic. She's literally one of the very few recognized lipedema specialists in the whole country. She actively contributes to research with the Lipedema Foundation, and she even spearheaded the Lipedema Provider Roundtable to raise awareness and push for better standards of care on a national level. But at her core, what really matters is that her approach is rooted in compassionate, holistic advocacy. She totally gets that treating lipedema isn't just about managing physical symptoms, it is about validating the massive emotional and lifestyle hurdles her patients have been dealing with for years. Section 4. Advanced tracking and diagnostics. To completely remove the guesswork, the clinic relies on some seriously cool, cutting-edge tech. First up is the ShapeScale 3D. This uses photogrammetry to build a highly accurate, rotating 3D model of your body. It's fantastic for validating if therapies, like lymphatic drainage, are actually doing their job on the affected limbs. The second tool is the in-body scanner. So while the shape scale is looking at your outer dimensions, the in-body looks beneath the surface using bioelectrical impedance. Basically, it sends safe, tiny electrical currents through the body to accurately measure fat, lean muscle in critical water balance. Having both of these tools allows the clinic to rigorously track swelling and inflammation over time rather than just eyeballing it.
Section 5. Your first lipedema visit. So what happens when you actually walk through their doors? Let's remove the anxiety right now. Your first visit is a highly structured 1-hour comprehensive consultation. Step 1, you sit down with a nurse practitioner to review your entire health history and run that advanced in-body scan we just talked about. Step 2, they take really precise baseline limb measurements so they have concrete, hard data to track your progress against. For step 3, you meet directly with Dr. Joel. She goes over all this data with you, explains the exact differences between lipedema and other conditions, and maps out a personalized care plan. And finally, step 4, you get a hands-on session with a specialist to get fitted for a pneumatic compression pump, along with a full demo. You leave the clinic totally confident in how to support your treatment at home. It is incredibly thorough. If this kind of structured, data-driven, and highly compassionate approach sounds exactly like the answer you have been desperately searching for, the Joel Wellness Clinic is currently accepting new patients. They operate out of 2 very convenient locations in Michigan, one in Livonia and one down in Ann Arbor. And they offer specialized programs for more than just lipedema. They cover medical weight loss, primary care, and hormone therapy too. I really want to leave you with this final, provocative thought. Just take a second and think about your own health journey. Or maybe the journey of a mother, a sister, or a close friend. Think about how much totally unnecessary guilt and frustration has been carried for years over what was perceived as a failure to lose weight. Well, armed with this new understanding, you now have the power to reevaluate those struggles entirely. Could that stubborn, painful weight actually be lipedema? And more importantly, now that you know the tools and the experts are out there waiting to help, what step are you going to take next to reclaim your health?